I definitely need my chai before I then go take a nap. But before that, I wanted to talk about ovarian cysts. And this is a really common topic that comes up in the office, in my private practice, online. I get a lot of DMs about ovarian cysts, and it's a really um, uh, a common topic amongst women, and sometimes quite anxiety provoking. And so we're gonna talk about ovarian cysts today, debunk some myths, and hopefully get all your questions answered. So please send them through the chat as you come on. And I know we did get some questions ahead of time, so I'm gonna go over those right now. So we'll post them up here and start answering some of those questions. Okay, so ovarian cysts are really, really common. And one of the things that most women worry about when they have an ovarian cyst is, oh my goodness, is this going to be cancerous? We've all heard about how ovarian cancer can present very late, doesn't have a lot of warning signs, and can be, this is a really serious cancer. And so people are always worried about cancer. But most ovarian cysts are actually benign. So let's start off by, what are ovarian cysts and why do they develop? So ovarian cysts are cysts on the ovary. Now, what is a cyst? It is often just a fluid-filled ball is a fluid-filled ball. And often they're benign. Every time you ovulate, which is every time you have, your period in the middle of your cycle, all women form a little cyst, and they usually burst and go away, which is, the egg that's released. But sometimes it hangs on and starts to accumulate fluid and can actually become a cyst. And some of these can get pretty large. So these are very benign types of cysts. They are not dangerous. But other cysts can actually have solid components and various material in them, including hair and nails and teeth. They're really kind of gross, actually, in the operating room. And so there's many, many different types of cysts, and the large number of them are actually not dangerous. But of course, there are some that are dangerous, and we will touch upon that as well. Like, when do you know when to be worried and when not to be worried? And so we talked a little bit about why they develop. Sometimes they, you don't have any symptoms. And so this is another reason to really get that annual GYN checkup to make sure your gynecologist doesn't feel anything. Okay, so let's move on to our next question. What are the most common symptoms of ovarian cysts, and how can women recognize them? So sometimes women will have pain. They'll have a pressure-like feeling. They will have increased pressure or pain during their period, or maybe even during ovulation. Sometimes they'll get like a sharp pain when they turn or when they run or do some exercise. Sometimes pain during sex. So these are all symptoms of ovarian cysts. Sometimes, though, there are no symptoms at all. So you may have a big ovarian cyst and you're just fine going about your day. You have no symptoms. And so it's tricky to recognize them. Certainly, if you're having any of these symptoms, that is time to definitely bring this to your GYN's attention. We do an exam, we get some imaging, we look into your pelvis, look into the ovaries, see what's going on. But otherwise, like I mentioned, it can be hard to recognize. And sometimes we figure them out when patients are getting a scan for something else. And incidentally, there'll be an ovarian cyst. So the best thing I would recommend is make sure you see your GYN and don't ignore symptoms. So if you're having pain, if you're having pressure, especially on one side of your pelvis, then don't ignore it. Make sure you bring it up to your doctor. Okay. Let's see, what other questions? Can ovarian cysts affect a woman's ability to conceive or maintain a pregnancy? So, depending on the type of ovarian cyst, particularly an endometrioma or a cyst that is filled with endometriosis. These kinds of ovarian cysts can impair fertility. We don't exactly know how, but there are certain chemicals that are, or signals that are put out by these cysts that prevent the egg from going down the fallopian tube and actually meeting the sperm. Now, if you have these types of cysts on the ovary, chances are you also may have a little endometriosis elsewhere in the body. And once again, this can affect your ability to conceive. Now, once you do have a cyst, it rarely affects pregnancy in that, it's not going to affect a growing baby or prevent the uterus from growing or anything like that. However, if a cyst starts to twist on itself, what we call torsion, or if it's starting to cause pain, it can also do that in pregnancy. So that's something to watch out for. Often I see women with large ovarian cysts who say, "Oh, should I take it out before I get pregnant?" And the answer is often yes, because you don't want to then have issues during pregnancy, but it's not going to prevent you from getting pregnant. Um, Most of these ovarian cysts, except endometriomas. So that's the one to really look out for, and we can find that out based on MRI or even ultrasound. All right, let's see, what else do we have? What are treatment options for ovarian cysts, and do all cysts require surgery? Okay, this is a great question. Um, a lot of times, to prevent ovarian cysts from growing or continuing to enlarge and become symptomatic, we often suppress it by giving birth control pills. So this is a really common way of preventing the natural cycling of the hormonal changes in a woman's body, and kind of giving a very steady state hormones through birth control pills and preventing ovarian cysts from growing. So this is one thing that we can do. Now, when do you need surgery? This is a common question I get. I have a 5 centimeter cyst. Should I take it out? Should I not take it out? The things that we consider when determining this are, number one, are they causing symptoms? So is it causing pain? Is it causing pressure? Number two, what is the size of the cyst? Is it greater than 5 centimeters? Is it 10? Is it 15? Usually when cysts are greater than 5 centimeters, they have an increased chance of twisting on itself. So imagine a big water balloon with a stalk. It can actually start to twist on itself, and that stalk is going to start twisting and cutting off blood supply to this balloon. And so when you have a cyst like that in an ovary, if it's starting to twist on itself, it can cut off blood supply to the ovary, and this can be a surgical emergency. This is called a torsion. And if this is not taken care of promptly, you can actually lose your ovary. So this is kind of a big deal. So if you're having symptoms like nausea, pain that comes and goes, and it's present for several hours, this is time to seek care, and often that will lead to surgery. And number three, what are the characteristics of the cyst? If it looks like there are solid materials, solid components, we worry a little bit more that this could actually be something more dangerous, versus if it's a cyst that's just filled with fluid like a balloon, then we tend to just watch it, repeat your ultrasound in 6 months, and there's no surgical emergency. So these are the considerations that I would think about when you are thinking about, should I do surgery or not? So think about the size, think about the symptoms that it's causing you, and think about what type of cyst it is. Okay. So, how can women prevent ovarian cysts from recurring, and what lifestyle changes might help? So, for women who keep getting ovarian cysts, they get a cyst, it bursts, then 5 months later, they get another cyst, they get it removed, then a year later, they get another cyst. So this can be pretty frustrating, as you can imagine, and you don't want to be just going to the operating room every 6 months. And so hormonal treatments can definitely help with keeping ovarian cysts away. So, combined birth control pills are a great option. Even a low dose pill will really help. So, that's one of the many things that we use to prevent recurrence of ovarian cysts. As far as lifestyle changes, we don't have a ton of data on lifestyle changes and its relationship to ovarian cysts. But of course, for all my patients, I recommend an anti inflammatory diet, plenty of fruits and vegetables, increased protein, and less processed food and sugar. We know that so many gynecologic conditions are tied to your diet. And so the more clean we can eat, the better. So that's what I would recommend for everybody. Okay. Let's see. Is a corpus luteum cyst the same as a hemorrhagic cyst? And does it just disappear? That's a great question. And a corpus luteum cyst is often one of the most frequent cysts that we see. This is the cyst that you get every single cycle when you ovulate. You get to make a corpus luteum cyst, and if it releases the egg, it goes away. If it doesn't, it can hang out there for a little while. If it bleeds a little, then it becomes hemorrhagic. Hemorrhage just means bleeding. And so these cysts are not dangerous. You can often just kind of watch them. If they're small, if they're less than 5 centimeters, you don't even need to keep monitoring it. And they often just will go away. So again, these are nothing to be worried about. But of course, if it's causing you symptoms like pain, pressure, cramping, then it's time to take a look. Okay. What is your opinion in taking Zoladex before removing fibroids? Okay, so we have a fibroid question. So I know about Zoladex only because I did an Instagram live yesterday with Dawn Heals from London, and Zoladex is a medication used. It's similar to Lupron in the U.S., and it helps shrink fibroids. And so in general, I don't like to use these medications before surgery for fibroids because they can actually change the surgical planes when we're trying to operate and remove fibroids. So if we know that we have to do surgery for fibroids, I just prefer to go straight to surgery. I don't like to use Zoladex. However, if we are trying to do a minimally invasive hysterectomy, so somebody has a huge uterus and we're trying to shrink it down so we can do it robotically or keyhole surgery, laparoscopic surgery, then this medication is useful. So thanks for that question. Not entirely related to ovarian cysts, but very, very relevant to women with fibroids because it's super, super common. So I would love to take any other questions right now. If any of you are watching, I'd love to answer questions. In general, I think a couple of points that I want to leave everybody with is number one, ovarian cysts are super common. So all menstruating women literally have a cyst every single month. So they're really common. There's nothing to worry about unless they are persistent or they start to cause symptoms. So the second point that I want you to remember is that not all ovarian cysts are equal. There are some that are just fluid filled and then there are some that are, more suspicious looking and we may recommend removal, but not all cysts need to take you to the operating room to have them removed. And number three, whether they look dangerous or not, especially if they don't look dangerous, if they are causing symptoms, don't ignore them. If they're causing symptoms, then it is worth considering going to the operating room to actually have it removed, especially because large ovarian cysts can cause torsion or the twisting of the cyst, which can cause a young person to lose their ovary. So those are the kind of takeaway points that I want you guys to think about. Feel free to DM me with any questions. Follow me on social media. And if you are in the Bay Area and you're looking for a gynecologist, maybe you have a large ovarian cyst and you're not sure, should you leave it? Should you just keep checking up on it every few months? Should you take it out? Come and see me. I'm happy to go through that with you. Or maybe you have a large ovarian cyst and your gynecologist has said, you know what, the only option for this is we got to do an open surgery. So we're making a big incision to take out the cyst. I can often do these laparoscopically or robotically. So if you're seeking a second opinion, I'm happy to see you. I am in the Bay Area, in the San Francisco Bay Area in California. So we'll put my information below for those who want to do a consult. Okay, so I'm going to answer one other question again on fibroids. Do herbal teas work to shrink fibroids beside healthy eating? So there's no correlation or data or science that we see between herbal teas and shrinking fibroids. Now, herbal teas like ashwagandha teas, green teas certainly have great properties for your health in general, for preventing inflammation, for example. So many women drink them for those reasons, and so I definitely recommend that. But there's no direct correlation between that and shrinking fibroids at this time. Hopefully, we'll have some answers for fibroids pretty soon, but unfortunately, not right now. Okay. Well, that was great. Thank you guys for those who watched, sent in questions. Really appreciate it. And we'll see you next Thursday on our episode of Chai with Cheruba. If there are topics that you really want to hear about, send us a message and we'll be happy to put it on our show. All right. Have a great Thursday, everybody. Bye.